Pneumonia is a lung infection that causes inflammation in the air sacs, alveoli, which may fill with fluid or pus, making it difficult to breathe. It can be caused by various pathogens, including bacteria, viruses, fungi, and other microorganisms. Pneumonia can range from mild to severe, with potentially life-threatening consequences, particularly in vulnerable populations such as the elderly, children, and individuals with weakened immune systems. Causes of pneumonia. 1. Bacterial pneumonia. The most common cause of bacterial pneumonia is Streptococcus pneumoniae. Other bacteria, such as Haemophilus influenza, Staphylococcus aureus, and Mycoplasma pneumoniae, can also lead to pneumonia. 2. Viral pneumonia. Viruses like the INF. This occurs when food, liquid, or vomit is inhaled into the lungs, leading to infection. 5. Hospital-acquired pneumonia, HAP, pneumonia contracted during hospital stays, often caused by more resistant strains of bacteria. Risk factors for pneumonia. 1. Age. Young children and elderly adults are more susceptible. 2. Weakened immune system. Conditions like HIV, AIDS, cancer treatment, or organ transplants can increase the risk. 3. Chronic diseases. Conditions like asthma, chronic obstructive pulmonary disease, COPD, diabetes, and heart disease can increase the likelihood of developing pneumonia. 4. Smoking. Smoking damages the lungs and weakens the immune system, making individuals more vulnerable to respiratory infections. 5. Recent illness or surgery, REIS. 4. Chest pain. Pain or discomfort that worsens with coughing or deep breaths. 5. Fatigue. Feeling tired or weak. 6. Confusion or delirium. Particularly in older adults, pneumonia can cause confusion or changes in mental state. 7. Sweating. Excessive sweating, often due to fever. Diagnosis of pneumonia. 1. Physical examination. A healthcare provider listens to the lungs using a stethoscope to detect abnormal sounds such as crackles, wheezing, or decreased breath sounds. 2. Chest X-ray. A chest X-ray is the primary imaging test to confirm pneumonia and assess the extent of lung involvement. 3. Blood tests. Blood cultures can identify bacterial infections, and a complete blood count, CBC, may show elevated white blood cell counts, indicating an infectee. For bacterial pneumonia, appropriate antibiotics are prescribed based on the specific bacteria causing the infection. The choice of antibiotic may be adjusted based on culture results. 2. Antiviral medications. If pneumonia is caused by a virus, antiviral medications may be prescribed, but they are not effective for all viruses, e.g., common cold viruses. 3. Antifungal medications. Fungal pneumonia is treated with antifungal drugs specific to the fungus identified. 4. Oxygen therapy. For severe pneumonia, supplemental oxygen may be required to help maintain adequate oxygen levels in the blood. 5. Cough medicine. In some cases, a healthcare provider may recommend medications to help manage coughing or clear mucus from the lungs. 6. Hospitalize. Regular hand washing and using tissues or elbows when coughing or sneezing can prevent the spread of infectious agents. 3. Quit smoking. Stopping smoking helps improve lung function and reduce the risk of respiratory infections. 4. Maintain good health. Managing chronic health conditions, e.g., diabetes, COPD, and boosting immunity through a healthy diet, exercise, and sleep can reduce the risk of pneumonia. 5. Avoiding risky environments. Avoid close contact with individuals who have respiratory infections, especially during flu season. Complications of pneumonia. Sepsis. A severe infection that can spread to the bloodstream and organs. Respiratory failure. A condition where the lungs cannot supply enough oxygen to the body. Lung abscesses. Pockets of pus that form in the lungs. Pleural effusion. accumulation of fluid around the lungs, which can cause further complications. Prognosis. The prognosis of pneumonia varies based on its cause, severity, and the individual's overall health. With timely diagnosis and treatment, many individuals recover fully. However, pneumonia can be fatal, especially in the elderly, those with chronic conditions, or those who delay seeking medical care.